Meningitis and septicemia, common signs and symptoms. Babies and toddlers. Fever, cold hands and feet. Fretful, dislike being handled. Rapid breathing or grunting. Unusual cry moaning. Stiff neck, dislike of bright lights. Refusing food and vomiting. Drowsy, floppy, unresponsive. Pale, blotchy skin, spots, rash. Tense, bulging. Fontanelle, soft spot. Convulsions, seizures. Be aware. Meningitis and septicemia often happen together. Be aware of all the signs and symptoms. Symptoms can appear in any order. Some may not appear at all. Early symptoms can include fever, headache, vomiting, muscle pain, fever with cold hands and feet. Someone with meningitis or septicemia can get a lot worse very quickly. Keep checking them. Trust your instincts. Get medical help immediately. Children and adults. Fever, cold hands and feet. Drowsy, difficult to wake. Severe muscle pain. Severe headache. Dislike of bright lights. Vomiting. Confusion and irritability. Pale, blotchy skin, spots, rash. Stiff neck. Convulsions, seizures. Septicemia. Some bacteria can cause meningitis. Septicemia, blood poisoning. People with septicemia may develop a rash or tiny red pin bricks, which can develop into purple bruising. This rash does not fade under pressure. Do the glass test. Press the side of a clear glass firmly against the skin. Spots, rash may fade at first. Keep checking. Fever with spots, rash that do not fade under a pressure is a medical emergency. Do not wait for a rash. If someone is ill and getting worse, get medical help immediately. On dark skin, the spots rash can be more difficult to see. Do not wait for a rash. Be aware of all signs and symptoms. Getting medical help. If you are concerned it could be meningitis or septicemia, you can call NHS 111, NHS 24 or your GP. In an emergency, you can dial 999 for an ambulance. Go to your nearest accident and emergency department. Describe the symptoms and say you will think it could be meningitis or septicemia. Early diagnosis can be difficult if you have had advice and are still concerned. Get medical help again. Trust your instincts. Get medical help immediately. Because the person with meningitis and septicemia will need hospital treatment as soon as possible, very quickly. So it's very important to get medical help.